Today's training techniques have taken the athlete's body to such a level that there's very little room between staying healthy and getting injured. As therapists, we need to understand how to handle common sports injuries so that we can support the healing process. We do this 4 ways: by managing edema, looking for compensation patterns, encouraging healthier scar tissue formation, and giving recommendations for stretching and strengthening. We can help to manage edema by the application of ice and by facilitating lymphatic flow. Then we need to assess tissues, listen to the athlete's evaluation of how they feel, to find compensation patterns. It's like hunting for puzzle pieces that fit. Injuries, especially chronic injuries, will involve other areas of the body. Restrictions, decreased range of motion will cause the body to become unbalanced. We want to manage these areas for athletes to be pain-free. Next, we try to help form the healthiest scar tissue we can. Healthy scar tissue is functional, meaning it does not adhere to surrounding tissue and cause irritation. It's pliable and moves with the muscle tissue. Finally, we can assist the athlete with stretching and strengthening recommendations. The athlete needs to correct or stabilize problem areas in order to fully heal. Before we begin examining sports injuries, you will need to understand the difference between injuries, which are either acute, subacute, or in a chronic stage. An injury that is acute has a definite onset. The athlete will know exactly when that injury happened. You'll most likely find pain and swelling because of tissue damage that's happened in the past 24 to 48 hours. Our goal at this stage is managing edema and assisting in lymphatic flow. The athlete must be assessed by a physician if there is a significant amount of pain. A subacute injury is an injury that was acute but now is in the healing stages. The athlete may have returned to light workouts and is in a process of rehabilitation. Our goal at this stage is centered around managing compensation and encouraging healthy scar tissue formation. A chronic injury is one that has been gradual in its onset and sometimes has been an ongoing problem for the athlete for quite some time. Oftentimes it's a result of overuse of a muscle group or muscle imbalances that lead to improper biomechanics. An athlete will complain about discomfort and tightness, points of tenderness, and may report a decrease in performance levels. This is when you need to do some investigating into what the cause of the pain is by assessing the tissues, asking questions, and actively listening to the athlete. Now we'll cover individual injuries for various athletes. When treating any injury, be very aware of 2 things. First, make sure the athlete is making steady progress. The injury should be decreasing in pain during rest and while they're exercising. The athlete may need additional attention from another part of a sports medicine team to heal properly. And second, if you discover swelling, redness, or the athlete reports an increase in pain, refer them on to a physician for further evaluation. Field and court sports will most likely have the highest incidence of acute injuries. This is because quick lateral movements and jumping are so common. These types of movements are more likely to cause tearing and tissue sprains. In games where multiple players are involved, there's an even higher chance of contact injuries. For court sports, we'll focus on inversion ankle sprains, low back pain, and tennis elbow. An inversion ankle sprain will involve the talofibular ligament and sometimes even the calcaneal fibular ligament. You'll probably be encountering some swelling and even some bruising that can leak down into the foot. So what you'll want to do first is work proximal to the injury and supply some lymphatic drainage to the area to help alleviate the edema. You'll do this by getting a little bit of oil on your hands and apply some light lymphatic effleurage, working the edema and the metabolic wastes up so the lymphatic system can take care of that. Be gentle when you're holding the ankle. Also go ahead and do the anterior portion along the anterior tibialis. Once your athlete has pain-free movement and the swelling has gone down, you'll want to go ahead and address scar tissue that will be around these ligament areas. To create functional scar tissue, use circular friction around the damaged tendons. This will help decrease adhesions and increase range of motion. Next, you'll want to progress to the muscles that act upon the ankle. You'll want to address the gastrocnemius, the soleus, the peroneus longus and brevis, and also the anterior tibialis. To do this, use direct compression on the soleus, medially, and laterally. These muscles respond very well to broadening techniques to decrease tension in this area. You'll start with the Achilles tendon and work your way up the muscle belly, pushing in and broadening the area, breaking up adhesions, and then complete the posterior leg with some effleurage. Encircling the muscle, stretching the fibers, now you'll address the peroneus brevis and longus. Again, use compression strokes along this outside area, pushing straight in onto the muscle belly, creating hyperemia, and stretching the muscle fibers. While you're doing this, assess the tissues for any adherences that you may find. Use circular frictions to help break up these adhesions. And use some nice effleurage on the lateral compartment of the leg. And lastly, you want to address the anterior tibialis muscle. Again, with direct compression, straight into the bone, bringing blood to the area, broadening the tissues. Then you use longitudinal stripping to help lengthen the fibers that have been shortened. And finish off your treatment with effleurage strokes to the anterior tibialis. Now your athlete is ready for some strengthening exercises. To gain stability in this joint, have your athlete stand on one foot. This will help strengthen the muscles around the ankle. Your athlete will hold this position for 15 to 20 seconds. And then come back on to two legs and do some ankle circles and relax that joint. And then go for another 15 to 20 seconds. You'll do this twice. Once the athlete finds this easy to do, go ahead and have them close their eyes. This brings on a whole new challenge and strengthens the ankle further. Low back pain is very common in a lot of sports. This is because so many muscles are involved when moving the hips and the low back. You'll want to assess your tissues very carefully before you provide any treatment. One of these tests is for the psoas and the iliacus. What happens when you raise the knee is that the pelvis will tilt posteriorly, and it'll drag this hip and this thigh up along with it. So what you're looking for as you're pushing this side into flexion and posteriorly flexing the hip is for the opposite side to follow with that movement. So you'll be pushing on the knee and watching for any movement in the opposite hip and the opposite thigh. To relieve tension in the iliopsoas area, I've placed a bolster under the opposite leg to help relieve tension in the low back. Now what I'm going to do is go ahead and make it a little more comfortable for my athlete by raising the leg when I'm locating the psoas and the iliacus. What I'm looking for is the psoas and the iliacus to be active underneath my hand. What I mean by that is I'm going to have Justin, will you go ahead and raise the knee? And what you'll feel is the psoas engaging underneath your fingers. Okay, so this is where you're going to want to keep your hands positioned at all times during this exercise. Now what I'm going to have Justin do while I am pushing on his psoas and iliacus area is I'm going to have him straighten his leg out into a full position. Good. And back up. And again, nice and slow, Justin. Good. And back up. And you want to do this about 3 or 4 times. All the while I'm keeping pressure on the psoas and the iliacus area. I'm starting to feel some softening and some releasing here. Good. And up. And then I'll go ahead, with my tension still kept here, I'll go ahead and outwardly and inwardly rotate on that psoas area to further release tension. Next, you'll want to assess the gluteal tissues and get them soft and pliable. Pay special attention to the piriformis muscle. The sciatic nerve goes underneath this muscle, so you want to make sure that there's no adhesions to that area and there's no tender points. And now I'm going to go ahead and broaden this area by just giving a little twist. With my fist, keeping my wrist straight and leaning in. And once I've done that, I'll want to go ahead and directly address that piriformis muscle by doing some frictioning around the origin area by the sacrum, finding tender points and doing circular friction. And then moving all the way down the length of the muscle. I'm putting quite a bit of pressure into this area. You want to be careful over the sciatic nerve area, not put too much pressure in that place. And then you want to move clear to the greater trochanter and do some nice cross friction around this area. Help loosen up the adhesions. And then you'll want to end your gluteal massage with some nice broadening again. What you'll find on low back pain is when the psoas and the iliacus are tight, it will pull the hip into an anterior position, which will cause the opposite quadratus lumborum to shorten. And this is a compensation pattern that you really want to look out for. So what you'll do is you'll assess the quadratus lumborum by looking at the posterior iliac spine alignment. Usually you'll find that the affected shortened side is slightly raised and pulling this hip up. So you want to assess that and treat the contracted side. So you'll get a little oil on your hands. Broaden the area by pushing down on the iliac spine and pushing up on the erector spinae muscles. The quadratus lumborum originates from the transverse processes of the lumbar vertebrae. So you want to be stretching the hip down from where it inserts to its origin, creating some nice warming, freeing the adhesions in that area. Go ahead and do some more point-specific work by looking for tender spots on the transverse process themselves, where it originates from. Oftentimes you'll find nodules, and the client will report pain. Is that a little sore in there?
Yeah.
Yeah. Hold that area. Maybe do a little bit of circular friction to help release those adhesions. Work all the way up and down on each transverse process, taking your time to find the edge and do some circular friction. And then go ahead and finish out again with a nice lengthening stroke. Again, to remind those muscles to lengthen and stretch on this shortened side. And then we're going to finish out this quadratus lumborum treatment with a little bit of stretching that will help further release the tension. Stretching the quadratus lumborum really helps relieve tension in that area. This is an active stretch that Justin's going to be doing, and we're going to be stretching out the quadratus lumborum on this side. So what I'll have Justin do is cross your arms for me, will you? The key thing with this stretch is make sure that their hip is on the chair when they stretch. Lean to the side and just keep a hand here to make sure that he's seated on the chair. Do you feel a stretch there? Mm-hmm. Okay, and then you want to stop. And then, Justin, what I want you to do is go ahead and push against my hand with about 20% of his strength. And we're going to hold that for 10. Good. And then I'm going to have him go a little bit further for me. I'm not pushing on him at all. He's actively engaging the opposite side of his muscles. And then he's going to go ahead and push. Again, I'm keeping his hip on the floor, and I'm engaging that muscle, that quadratus lumborum muscle. And release one more time. Good. And push against me for 10 seconds. And then have them slowly come up. This will help keep that muscle elongated and keep the body compensation patterns to a minimum. One of the main injuries of tennis players is elbow tendonitis, commonly known as tennis elbow. This can be caused by a poor backhand technique or too small a grip on a racket. Sometimes it also can happen when the strings are too tight on the racket. Start with direct compression on the extensors of the wrist. This broadens the tissues and creates hyperemia in the area. And then you'll want to go ahead and specifically broaden the muscle bellies out. right in this area. You want to go ahead and take your thumbs and spread that tissue all the way over to the supinator muscle. You want to do that a couple of times because this really helps spread all the tissue that is adhered together because of overuse. Provide some direct circular friction to the lateral epicondyle. Look for places where the tendon attaches to the bone. These will generally be very, very painful, so make sure to check in with your athlete. And then you want to go ahead and do some compressive effleurage around this area. With one hand, you'll go ahead and stretch and flush that tissue, providing a good downward effleurage all the way out. Another good technique to help release tension in the lateral epicondyle and the extensors of the wrist, you want to go ahead and reach for these tendons of the extensor muscles and press down with a moderate pressure. Extend her wrist and then bring it back to neutral, slight flexion, and then extend it again. This helps relieve tension and increase circulation to the area. Have your athlete do it about 15 times. And then you want to go ahead and rub that area out. Some nice petrissage, relax the muscle area. And then go ahead and find that same spot of the musculotendinous junction and have your athlete extend the wrist again and bring it back. And she'll continue this until she does it another 15 times.